It's difficult to find a competitive advantage that isn't something someone's already thought of. In the next 5 minutes, I'm going to give you the first possibly positive view of Obamacare that you've heard. Here's my problem. We need a good crisis to move forward. And on the people side of your customer's business or in your firm, the implication of health insurance reform is one of the largest crises that will hit the whole human capital side of American commerce in our lifetimes. A quick 1-minute indictment of what's going on in commerce. Performance management, simply put, is not working. We've got 5 generations now that are not working together. The latest generation just arrived. If they're 19 and under and you've hired an intern, we don't even have a name for them yet. I dubbed them the Generation Wi-Fi. They don't have to know anything. They can look it up on Google. So it's kind of like millennials or Gen X on fast forward with an attitude. Good luck with that. Since 2008, we've got burnout of the high performers and the walking wounded, where everyone's gripping their chairs and hoping no one notices. And as we're starting to hire, correct me if I'm wrong, we don't have a body shortage. We have a talent shortage. At the same time, the cost of healthcare is hurting our global competitiveness. Employee health, at the same time, we are spending 8 and 10% a year more. If you look around, or have you gone to the state fair, employee health is trending down. At the same time, the key marketplace, the key thought leaders of the chief financial officer world do not trust human resource metrics. Now, the challenge is we often don't act when there's a good crisis. So let me, since we're a mostly financial group, let me scare you with some statistics. If we go out and look in the world where the United States stacks up, something interesting emerges. If I ask a room full of business leaders, do we have the best healthcare system in the world? They generally are inside the echo chamber and will say, yes. Okay, well, watch these numbers. On the left, I've got how much the average country spends per citizen per year on healthcare. And on the right, I have the output of that. The average number of years an adult will live in that country. An input and an output. Okay, if we look for a median, Great Britain spends about $3,000 and gets about 79.2 years. Canada has a slightly more efficient system, spends slightly more, gets slightly more for it. Mexico spends $950 and doesn't have an efficient system and gets less for it. Do you get the model? Japan, they have a lot of dietary and cultural issues happening here, but they have a whole different medical delivery system. Look at how efficient it is. Would you like to see where we fit into this? Any questions? We are spending slightly more than twice as much as the nearest competitor, which is, I think, Denmark, and we're 37th on the list of outcomes. What we were doing was unsustainable. Obamacare had to happen. Now, it is the law. Newsflash. We will have to get engaged and make it happen. From an ROI standpoint, engagement does pay off. I'm showing you a chart. I know it's dangerous to put charts in front of people, but the big line at the top is the public share stock performance of every organization that uses the employee engagement surveys of Walker Information, a survey firm I work with. The bottom line, much lower than that, is the Dow Jones Industrial Average. In general, if you do a good job of engaging your employees, you're going to get a better result. Because healthcare, the bottom lines, that's what we're paying people in inflation. The top line, that's what we're paying for healthcare. This is not sustainable. Also, we do hate PowerPoint. The more charts we have, the more likely that someone will scream. I'm such a geek on this, I was on the steps of the Supreme Court paying attention. And here's my simple challenge for you today. If you can understand health insurance reform better than your competitors, and if you can implement it better than your competitors and simply explain it in 30 seconds, like I'm doing on this slide, you will have a good competitive advantage. Health insurance reform is only three things: expanding coverage, getting quality up, and figuring out a way to pay for it. Every sentence in the bill, that's all it does. Now, it's messy. We have to get this right. If this fails, the revolt will come from a surprising place. That's a room full of CFOs. Show of hands, how many of us are CFOs? You will be leading the revolt in 5 years if the Affordable Care Act does not bend the curve and the cost of health care doesn't moderate. It's the CFOs that are going to light the torches, grab the pitchfork, storm the castle, and stop paying for health care. Am I right? And at that point, we'll go single payer. So we've got about 5 years to get this right. What do we need? It's pretty simple. You need a plan to guide yourselves. You need a logic model to that process. And you need a crisis to add a sense of urgency. Do we have the crisis? We do. What are the answers? You need a strategic plan that is aligned with your corporate strategic plan. A strategic plan for benefits aligned with your strategic plan for human capital. Your clients need this also. And the real answer is not getting sick. Implement wellness and do it well. And you can do that. And then the third thing that has to be done in the next 8 months is communicate well. Toastmasters, this was in an HR department. It was clearly a Gen Xer who didn't know how to spell. And finally, we have to hire and manage for values that are aligned with wellness and good health behavior. So, we need to use this crisis to change our organizational behaviors. And if we can do that, we will be a very competitive nation within 5 years. Thank you very much.